All right. Good afternoon or good morning, everyone, depending on where you are. Thank you all for joining us today for our Financial Toxicity and Cancer webinar presented in partnership with Triage Cancer. Triage Cancer, thank you so much for joining us today. This is our first webinar hosted on Teams as opposed to Zoom, so please forgive any potential tech hiccups we might experience during this event. I don't think we're going to have any problems. I think I've got everything ironed out, but you never know. So live webinars. My name is Zach Getty, and I am the Education Manager here at Fight Colorectal Cancer. Fight Colorectal Cancer is the leading patient empowerment and advocacy organization in the United States, providing balanced and objective information on colon and rectal cancer research, treatment, and policy. We are relentless champions of hope, focused on funding promising, high-impact research endeavors while equipping advocates to influence legislation and policy for the collective good. So before we get started, give me just a moment to go through a few of our housekeeping items. We will have some dedicated time at the end of this webinar for general questions. We typically have about 10 to 15 minutes or so, but please feel free to use the Q&A button at the top of your screen to ask any questions that come up along the way. We may answer them before we get to the Q&A session, but if something pops in your head, just go ahead and use that Q&A button. This webinar is meant to educate as well as serve as a forum for you to ask your questions and start conversations, so please don't be shy. We will do the best to answer any and all questions that are asked, but do keep in mind that we may not be able to answer any hyper-specific like legal questions or anything like that during this webinar. We will also have a recording of this webinar available on our site within the next few days, and you will receive that direct link via email as soon as it is available if you've registered for this webinar. We will also provide a transcript of the webinar on our site for those of you that would prefer to read the information discussed today. You can also tweet along with us. You can use the hashtag CRCwebinar. Please remember to stop by our website at fightcrc.org to check out all of our patient and caregiver resources. We offer a variety of free-to-use online tools, such as our Patient Provider Finder, which allows you to search for providers in your area with experience and expertise in treating colorectal cancer. We also have Chat CRC, which is our one-of-a-kind interactive tool that can answer your questions about colorectal cancer and related topics. That's available on our site or by text with your phone at 1-318-242-8272, which is Chat CRC. There's also our free Community of Champions app where you can connect with other people in the colorectal cancer space, keep in touch with Fight CRC, and know what we're up to. And we also offer an assortment of print and digital educational resources that are free to request and download, all available on our website. I have a quick disclaimer. The information and services provided by Fight Colorectal Cancer are for general informational purposes only. The information and services are not intended to be substitutes for professional medical advice, diagnoses, or treatment. If you're ill or suspect that you're ill, please see a doctor immediately. In an emergency, call 911 or go to the nearest emergency room. Fight Colorectal Cancer never recommends or endorses any specific physicians, products, or treatments for any conditions. So with all of that out of the way, I'd like to briefly introduce our panelists today. Joining us is attorney Laura Beilke, staff attorney at Triage Cancer. Laura, thank you so much for taking the time out of your busy schedule to join us today. I'm going to give you a chance to introduce yourself a bit more thoroughly, give us some insight into what Triage Cancer is all about, and a little information on your background before you get into your presentation. So thanks again for joining us. I'm going to stop sharing my screen. I'll hand it over to you.
Thanks, Zach.
Welcome.
Me bring it up. So hi, everyone. Like Zach said, my name is Laura Beilke, and I'm a staff attorney at Triage Cancer. I graduated from the University of Wisconsin-Madison with a Bachelor of Arts in Psychology and Neurobiology, and then I graduated from Brooklyn Law School, and I'm a member of the State Bar of Wisconsin. And to let you know a little bit about Triage Cancer, Triage Cancer is a national nonprofit organization that provides free education on the legal and practical issues that may impact individuals diagnosed with cancer and their caregivers. And to put today's presentation in a little bit of context, I first wanted to talk about what is financial toxicity. And financial toxicity is a term that was coined by some researchers in Duke in 2013, and it is used to describe the financial burden of a cancer diagnosis. But even though we have been talking about financial toxicity for more than a decade now, the reason that has been so hard to solve is that there are a lot of different contributing factors to financial toxicity. And there really isn't a one-size-fits-all solution. However, we at Triage Cancer think health insurance is the number one contributing factor. And that isn't just health insurance status itself, like whether or not I'm insured, but it's also, is that health insurance effective for me? And am I effectively using that health insurance policy? Certainly, the employment changes that can occur after a cancer diagnosis can impact finances. And then all of the things that happen in life that normally impact finances, like relationship changes or moving or graduating. Those life changes continue to happen and they compound the financial impact that somebody is experiencing after a cancer diagnosis. So in order to effectively address financial toxicity, all or at least most of these issues need to be addressed. We are mainly going to be focusing on health insurance today. And with that, we completely understand that health insurance is very difficult to navigate. Most Americans do not understand health insurance. In fact, 96% of Americans can't even define the most commonly used terms within health insurance. And if we don't know the terms used in our health insurance policy, how can we feel confident in comparing our health insurance options and effectively using that health insurance? So with that, before I go into our health insurance options and how to effectively use that health insurance, I do want to go over some basics first. And these are the terms that we think everyone should know about their health insurance policy. So the first is the premium, and this is a fixed dollar amount that we have to pay each month just to have our health insurance. So even if we never go and get medical care during the year, we still have to be paying this monthly premium. But then there are the terms associated with the costs when we do use our health insurance. So the first is the deductible, and this is a fixed dollar amount that we have to pay first before health insurance even kicks in and starts to pay for any portion of our medical expenses. So someone could have a $500 deductible or maybe a $5,000 deductible. Again, that's going to depend on the type of policy someone has. Then there is a copayment, and this is a fixed dollar amount that we have to pay first before we go and receive certain types of care. And I kind of like to think of it as an entrance fee to going and seeing our doctor, because we're typically going to pay this at like the doctor's office before we go in to see the doctor. So maybe someone is going to their primary care physician and they have a $10 copayment, or they're going to a specialist and they have a $30 copayment. The amount is going to vary depending on the provider we're seeing or the service we're getting, as well as the policy that we have. Then there is a coinsurance or a cost share, and these are two terms that are used interchangeably and mean the same thing. And it is the difference between what our insurance is going to pay for our medical expenses and what we're going to pay for our medical expenses. So someone could have an 80-20 plan. That means our health insurance is going to be responsible for 80% of our medical expenses, and then we're going to be responsible for 20% of our medical expenses. And then lastly, there is an out-of-pocket maximum, which we would argue is probably the most important thing anyone should know about their health insurance policy, because in a worst case scenario, this is the most that we are going to pay out of pocket for our medical expenses during the year. And out-of-pocket maximums can be a little difficult to understand, so I do want to walk through an example of how one would work. And so I'd like you all to meet Dan. Dan has a health insurance plan with a $2,000 deductible. It is an 80-20 plan, and he has an $8,000 out-of-pocket maximum. Dan unfortunately has an accident and he spends a week in the hospital, and he walks out of that hospital with a $102,000 hospital bill. How much does he have to pay? And for the sake of this example, we're going to assume that he's had no other medical expenses during the year. And I also want to walk through how we actually get to that answer. So first, he's going to pay $2,000 to meet his deductible, which leaves $100,000 left. And since now he's reached his deductible, his health insurance will kick in and they will pay for 80% of the bill and he'll be responsible for 20%. So 20% of the 100,000 is 20,000. But because he has that out-of-pocket maximum and he's already paid $2,000 towards his deductible, he actually only has to pay another $6,000 to reach the out-of-pocket maximum, and his health insurance will pick up the rest of that $20,000 bill. So in total, he only has to pay $8,000. And I am absolutely not suggesting at all that $8,000 is not a lot of money, because it is a lot of money, but it is a lot less than maybe having to pay $22,000, so his coinsurance and the deductible, if he didn't have that out-of-pocket maximum, or potentially that whole $102,000 hospital bill if he didn't have health insurance at all. So if you would like to hear this example again or go over those terms again, that is a part of one of our animated videos on health insurance basics. And now I like to say with the law, the devil is in the details, and that very much applies to out-of-pocket maximums as well, because some plans, depending on how we get that plan, and I mean, is it a marketplace plan? Is it an employer-sponsored plan? Those will like to carve certain things out of what is actually being counted towards the out-of-pocket maximum. So if someone has a family plan, they could have a separate individual out-of-pocket maximum as well as the family out-of-pocket maximum. If someone has a marketplace plan, those are probably the most protective for consumers, because those plans are required to count the deductible, any co-payments, any co-insurance amounts for both medical care and prescription drugs towards the out-of-pocket maximum. Now with employer plans, they very much like to get creative and will carve certain things out of what is being counted towards it. So some will not count any payments towards your deductible in the out-of-pocket maximum. Some will not include the deductibles or the out-of-pocket maximum. Now with employer plans, they very much like to get creative and will carve certain things out of what is being counted towards it. So some will not count any payments towards your deductible in the out-of-pocket maximum. Some will not include the deductibles or the co-payments towards the out-of-pocket maximum. And some may have separate out-of-pocket maximums for medical care and another one for prescription drugs. So not only is it important to know what our out-of-pocket maximum is, it's also important to know how we're getting that health insurance so we can figure out what is going to be counted towards it, so we can have a better expectation of what our actual out-of-pocket costs are going to be for that year. So those are some of the basics around health insurance, but we also wanted to go over how we can get our health insurance and what are our options, because we very much believe that it is important to know all of our health insurance options so we can effectively compare those options, so we're getting a plan that is effective for us. And at Triage Cancer, we find that very important, so we do have a lot of resources around this, a couple of quick guides, we have recorded webinars and animated videos on these topics. So where do we get our health insurance? And how do we actually compare those options to make sure that we're choosing one that is most cost effective for us? And I'm going to walk through an example of how we actually compare our health insurance options. I am going to be using marketplace plans as an example, but this exercise will apply if we're comparing maybe two employer-sponsored plans to each other. Maybe we're comparing a marketplace plan to a COBRA plan. Maybe we're even at the stage where we have Medicare and we're choosing Medicare Advantage plans for another Medicare Advantage plan. This exercise will apply in all those situations. So here are 3 health insurance options that are available to this person. We have a bronze plan with a $200 monthly premium and an $8,000 out-of-pocket maximum. We have a silver plan with a $275 monthly premium and a $6,000 out-of-pocket maximum. And then we have a platinum plan with a $400 monthly premium and a $2,000 out-of-pocket maximum. So if we're looking at just these options right here, can we just tell how much each plan is going to cost us by the end of the year? Maybe which one is going to cost us the least by the end of the year? And That is not a trick question. No, we cannot just tell by looking at them. We actually have to do some math. And how you do that math is you take the monthly premium and you times it by 12, because that's how much it's going to cost us just to have the plan for the year. And then we're going to add to that the out-of-pocket maximum. Because remember, in a worst case scenario, this is the most we're going to be paying out of pocket for our medical expenses during the year. So if we go through the math on each of the plans, the bronze plan will cost us $10,400 by the end of the year. The silver plan will cost $9,300. And then that platinum plan costs $6,800. So it turns out that that platinum plan almost saves us $2,000 by the end of the year. Even though I'm sure all of us get sticker shock at that $400 monthly premium, and we probably want to write that off as an option right when we see it. But that's because we're not taking into consideration that out-of-pocket maximum. And we really need to take that into consideration when we're talking about worst case scenarios. And in the context of cancer treatment, the likelihood is pretty high that we're going to be reaching that out-of-pocket maximum. So doing the math is incredibly important. We're comparing our plan options, but that's not the only thing we need to be looking at. There are a couple other considerations we need to be thinking about, and that is the network of providers and the prescription drug coverage. And that might sound obvious to some people, but I promise it's not obvious to everyone. It is really important to be looking into whether or not the providers we're going and seeing, any hospitals that we're going to, that's in network for our plan, as well as the prescription drugs we're taking are covered by our plan. And so it's really important to be looking at the costs, the network, and the prescription drug coverage when we're looking at our plan options. And we do have a few resources to help with comparing plan options. We have an animated video that goes over these key considerations, as well as a health insurance comparison worksheet, where it will help go through the math with you to compare the costs of the plan. You can either use it directly on our website and it will actually calculate it for you, or you can download it and do the math yourself. So where are there other opportunities to potentially lower costs? And I wanted to first talk about employer-sponsored health insurance, as there are a lot of times where someone is going through cancer treatment, or maybe they're acting as a caregiver and they need to take time off from work. But what happens if we end up losing our employer-sponsored health insurance? And there is a federal law called COBRA that allows us to elect to keep the exact same health insurance we had while we were employed. And there are some pros and cons with COBRA. Some pros are that you'll have the same network of providers, you'll have the same prescription drug coverage with that plan, plus anything you've already paid towards your deductible and your out-of-pocket maximum will continue if you elect COBRA. One common con that we hear with COBRA is that it can be expensive, because now you will be responsible for 100% of the health insurance premiums if you choose to elect it. But there is this program that we wish a lot more people knew about, which is called the Health Insurance Premium Payment Program. Now, this is a voluntary program that is optional for states to have. But if someone qualifies for this program, what will happen is that the state will actually pay your employer-sponsored premiums for you. So even if you have COBRA, the state could pay for your COBRA premiums for you. Well, how this happens is that if someone qualifies for their state Medicaid, but they have access to employer-sponsored health insurance, including COBRA, the state will actually do a cost analysis to see if it's less expensive to pay for all of your care under the state Medicaid program, or to pay for all of your COBRA premiums for you. Usually, it is less expensive for the state to pay for the COBRA premiums than for all of your care under the state Medicaid program. Now, this is an optional benefit. So again, not all states are going to have this as an option, but I would recommend looking at our chart of state laws to see if your state does have this program and could be an option for you. Another place where people get health insurance is through the state health insurance marketplace. And this is basically an online shopping mall where the only type of health insurance that someone can purchase, or the only thing that they can purchase, is private health insurance. And sometimes people will say that they think that the marketplace plan options are going to be very expensive, but they can actually be less expensive than what people think. Because one of the benefits with shopping on the marketplace is that there is financial assistance to make the health insurance less expensive, whether it's lowering the monthly premium or lowering the out-of-pocket expenses. And in 2025, there's actually more financial assistance now available than there really ever has been before. For example, 4 in 5 customers on the marketplace were able to find a health insurance plan for $10 or less a month. And there is even financial assistance for those who make more than 400% above the federal poverty level. So there's more financial assistance that helps a more wide-ranging group of people. I will say, and I'm sure a lot of people have been hearing about this in the news, is that this expanded type of financial assistance is currently set to end on December 31st of 2025. So the expanded financial assistance has not been chosen to continue in 2026. There is currently a shutdown happening over it, so we don't know if it's going to continue. So health insurance premiums could potentially rise depending if you're getting this expanded type of financial assistance. We will definitely let you know, or maybe you'll see in the news if that financial assistance does happen to continue into 2026. As for Medicare, there have been a lot of changes over the year to help address some of the out-of-pocket expenses that come with it, specifically under Medicare Part D, which is your prescription drug coverage. Thankfully, the changes became a lot less convoluted for 2025. And one of the major changes that came from the Inflation Reduction Act was a cap on what the out-of-pocket expenses are under Part D prescription drug plans. So in 2025, the max out-of-pocket maximum someone could have is $2,000. And this applies for anyone who has Part D prescription drug plans or Part C Medicare Advantage plans that have prescription drug coverage. We do know that that cap is going to rise in 2026, and we believe that that increase is going to be a $2,100 cap on Part D prescription drug coverage. Another major change that came with the Medicare Part D prescription drug plans was the introduction of the Medicare Prescription Payment Plan that allows you to spread out your out-of-pocket expenses over the year. So it's really not about saving it, because you're going to be paying the same amount whether or not you enroll in this plan or not, but it at least allows you to spread out your costs over the year. So if, let's say, you have high prescription drug costs and you're going to reach that $2,000 out-of-pocket maximum very early in the year, instead of having to pay $2,000 up front, you can actually spread those costs over the year. Now, this is a voluntary plan, so you can choose to enroll in it or not. You can also voluntarily choose to disenroll in it at any point. If you do choose to disenroll, though, you do have to pay any balance of your payment plan at that time. But what happens if you do choose to enroll in this plan? Instead of paying for your prescription drugs at the pharmacy, you will actually pay nothing at the pharmacy. Instead, what will happen is that you'll receive a bill from your prescription drug plan each month. So you'll actually be receiving 2 bills basically from your prescription drug plan each month, one for your prescription payment plan due, and then also for your monthly premium. If someone is struggling with their out-of-pocket expenses under Part A and Part B of Medicare, there are Medicare savings programs that can help with the premiums, the deductibles, the co-payments, and any cost share amounts. There's actually 4 different programs, but collectively they're called Medicare savings programs. And depending on which program you're in, they do have different eligibility requirements and have different benefits. If you would like more information on these Medicare savings programs, we do have a quick guide to Medicare savings programs that does talk about like the income eligibility requirements as well as which benefits you would get depending on the program. If someone is struggling for costs under the Medicare Part D, there is a program called the Low Income Subsidy, or LIS, or Extra Help. And this can help with your premiums, your deductibles, and any co-payments and cost share amounts. Some states also have state pharmaceutical assistance programs, just like that health insurance premium payment program. These are also optional for states. So if you would like to see if your state has one of these programs, as well as like the eligibility requirements and also what types of benefits you get from it, Medicare does have information on each state's program. So now I'd like to talk about how to effectively use our health insurance to help lower our expected out-of-pocket costs as well. So one thing that we think is incredibly beneficial for everyone to know about their health insurance is that if your health insurance says that they are not going to cover a specific medical claim, that does not mean that you have to take no as a final answer. There are actually 2 opportunities or 2 rights to appeal that decision. So the first opportunity is called an internal appeal. And this is where we are going back to the insurance company and basically asking them to reconsider their decision. If they still are saying no after that internal appeal, then the second opportunity is an external appeal. And this is where we're going to an independent third party that is completely separate from the health insurance company and asking them to see whether or not that medical claim was medically necessary and should have been covered by our health insurance. And what is so great about this external appeal is that it is binding on the insurance company. So if that external appeal says, yes, that was medically necessary and should have been covered by your health insurance now has to cover that medical claim. And I will be honest, this is one of those things that we talk about a lot that is very easy for me to say, go and do the appeals process when I'm sure you already have so much on your plate. And this is just more things that you have to worry about. This is more paperwork. This is more phone calls that I have to deal with. And you maybe don't want to take this on. But I want to tell you that there is data out there that says that when someone goes through that external appeals process, 40 to 60% of those appeals are found in favor of the patient. So that is telling us that when the insurance company is saying, no, we're not going to cover that claim, they're getting that wrong 50% of the time. So this is a hugely important tool that we have to use to help with our out-of-pocket medical expenses. The problem is, though, is that no one knows about the external appeals process. In fact, over 99.9% of denied health insurance claims never actually reach the external appeals process. So when we're talking about financial toxicity and access to care, the external appeals process is a hugely underutilized tool that we have in our toolbox, and which is why health insurance appeals has kind of become like a soapbox issue at Triage Cancer. And we have a lot of resources to help with it, including quick guides that go through the step-by-steps of the appeals process and any deadlines that might come up with it. We have a recorded webinar that goes into detail of it. And we also have a health insurance appeals module on our cancer finances page, where you can actually click on the type of health insurance you have, and it will go through the actual steps of how you go through that appeals process. Because depending on how we're getting our health insurance, the appeals process might vary slightly, as well as like the deadlines for those appeals. So even if we've done all the right things, we effectively compared our health insurance, we're effectively using that health insurance, we're utilizing that appeals process, the reality is that we're still going to receive medical bills throughout the year. And with that, there's a lot of correspondence that we're going to be receiving. Just from our insurance company, we could receive 3 different pieces of mail. One saying that they have received their claim, one saying that they're processing our claim, and one called an explanation of benefits, or an EOB. And this EOB will give us an idea of how much we are going to have to pay for a specific medical bill. I will say that these EOBs are a bit challenging to decipher, so I do want to walk through an example of an EOB. Now, again, this is an example. Every insurance company is going to present this information in a slightly different way, but it should at least have this minimum level of information. So the telltale sign that this is an EOB and not a medical bill is that somewhere on it, it's in big letters, it's going to say this is not a bill. But you'll also see information about the policyholder of the health insurance, a little bit of a summary of the claim. And then in the chart, that's where we're going to get a lot of information. So we're going to see information about the specific service, like the date of service, the type of service, possibly a CPT code. And then in that green part of the chart, we're going to see the amount charged, the amount paid by our health plan. And then in that orange box, that is where we're going to see what our expected costs are and what we're likely going to have to owe our provider. We'll also see information about how much we've already paid towards our deductible, as well as how much we've paid towards our out-of-pocket maximum, both for an individual as well as a family out-of-pocket maximum if we have a family plan. Now, we are not done with the correspondence we're receiving. We're also going to receive a bill from our provider, whether that's the actual doctor we're seeing or the hospital or the lab, maybe. The problem with all of this is that all these correspondence that we're receiving could be sent in different manners. So some might be sent physically in the mail, some might be only sent to us via email, some we may not only be able to access through like a patient portal. Additionally, they're likely not going to be sent in the exact timeline that we've been talking about them in. Providers are usually much faster at sending out a medical bill than the insurance company is at actually processing the claim. And we think it's really important to wait to pay for any medical bills until we actually receive our EOB. So we're not paying more than we have to up front and then be in a situation where maybe we have to ask our provider for any overpayment or even wait for the insurance company to provide a refund for any overpayment that we made. Now, if it is the fact that we have to wait for our EOB before we pay for any medical bill that we've already received, it is really important to communicate that with the provider so they aren't just expecting we're not going to be paying our bill. We are planning on paying it, but we just want our EOB so we can actually pay the exact amount that we owe. This is also a great time to ask any questions on maybe why we are being charged for a certain service that we didn't think we should be charged for. Also to appeal any denials that we might have received. This is also a great time to see if we maybe qualify for any financial assistance programs that are out there, like hospital charity care. And charity care is actually a financial assistance program that is required for nonprofit hospitals to provide. They can be called charity care, they could be called financial assistance programs, it could be called ability to pay programs. And these nonprofit hospitals are required to post their financial assistance programs in the hospital as well as online. but I will say through my own experience by trying to look these up, they can still be very difficult to find, which is why I want to tell you about another nonprofit organization called $4, which their whole goal is to provide information around these financial assistance programs, like which hospitals have them, what are the eligibility requirements for them. They can also help or assist in applying for these financial assistance programs, or even submit an application on your behalf. So this is an amazing nonprofit to utilize during this process. If you are in a situation where you do owe your provider, we recommend talking with them, whether it's about trying to figure out an extension of the due date, if it's trying to work out a payment plan with the provider, or maybe even negotiating a lower lump sum payment. In these situations, our motto is, it doesn't hurt to try. And I also wanted to point you to another resource that we have, which is our medical bill tracking worksheet. This can really help with probably all of the different correspondence that we're receiving, and also help with tracking how much we have left to reach our out-of-pocket maximum. And I just want to show you a little bit how it works. So in the top, you'll put in information about your health insurance, including what your deductible amount is and what your out-of-pocket maximum amount is. And then as you start to receive medical bills on the other half of the sheet, you can start putting in that information about the specific medical bill. And then as you do that, the top will actually start to calculate how much left you have remaining to meet your deductible, as well as your out-of-pocket maximum. So I keep telling you to keep records of things and keeping records of the medical bills. So we do highly recommend keeping track of those medical bills, any EOBs that we've received, but it can also be really helpful to keep track of those non-medical specific expenses that we have, if that makes sense, where like maybe any expenses we've had in travel and lodging to treatment, maybe any meals that we've had related to our medical treatment that we're going and receiving. Those can sometimes be submitted to savings accounts like our health savings account or a flexible spending account, and they usually want some sort of receipt for those expenses. Plus, even if you don't have those accounts, but maybe are thinking about doing the medical deduction for your taxes, it is important to keep these records, just in the scenario that maybe the IRS does want to contact you about that type of deduction. So the truth is too, there may come a time where maybe there's not enough money to go around with these medical expenses, and that's where financial assistance comes into the picture. And financial assistance can come in all different forms, whether it's through the federal government, the local or state government as well. But there's also a lot of nonprofit organizations and private programs out there that provide financial assistance. We at Triage Cancer have taken the time to gather information about these nonprofit and private programs that offer financial assistance and put it on our cancer finances page. So you don't have to go and do that Google search trying to find everything. We've put that all on our cancer finances page to take some legwork out of it for you. And we also have a specific module on prescription drug financial assistance. There are a lot of private programs that offer financial assistance specifically for prescription drugs. There's also a lot of pharmaceutical assistance programs out there. And of course, that can be copay assistance, that could be access to free drugs, but there's also a lot of free navigation services that these pharmaceutical assistance programs out there offer. And it's really important to tap into those existing free resources. And I will also just mention we have a specific chart on our website that does provide information about these pharmaceutical assistance programs. So you can search your drug name, you can find out who the manufacturer of that drug is, you can find the name of that pharmaceutical assistance program, how to access that program, and also what type of assistance that they offer. And in addition to that, I just wanted to mention that we have a ton of free resources on this topic and much more. Everything can be found on our website at triagecancer.org. We also offer educational events throughout the year. We have quick guides and checklists to help you navigate these different areas. And just to mention, we do have a Triage Cancer conference where we spend a whole day with you going over this information and much more to help provide practical strategies and tips to help reduce the financial burden and reduce stress. We had our last one in October, and 2026 dates will come out soon. We also have a free webinar series. We have one more this year on Medicare, but our 2026 schedule is out on our website. We just do not have the registration links up yet, but the schedule is there to see if you are interested in it. And of course, no matter what, how many resources we put out, how many presentations we give, people are still going to have questions, and we completely understand that, which is why we have our legal and financial navigation program, where we're able to provide one-on-one support to people. We do not provide legal representation or legal advice through it, but we will help explain the law that applies in the situation. We will help identify different options you might have, help weigh the pros and cons of those different options, and hopefully help you take next steps. If you are interested in talking with us, you can just fill out a very brief intake form on triagecancer.org/get help. And we do have a couple of Spanish speaking attorneys. So if anyone wants to speak to us in Spanish, we also have that option as well. And then I would also be happy to answer any questions that anyone might have.
Thank you so much, Laura. I have questions. I always love walking away from these things feeling like I've learned something, but I think generally the thing that strikes me first and foremost is that this is just really complicated and a lot to expect someone to navigate on their own, especially if they're dealing with a cancer diagnosis, is it not? Yeah, that's wild. You mentioned a few things. Something that stuck out to me is the insurance appeals process and the external appeals process. What are there navigation services available for people to kind of go through that external process? And if so, is that something that people would be expected to pay for, or?
Yes. So, I mean, there are different ways to get help with that external appeals process. I will say the number one help with the appeals process is, in general, is to work closely with your healthcare team, because they're the ones who are going to be able to provide the evidence of why a specific service or a specific prescription drug is medically necessary. And they're going to need that to show to either the internal appeals process or through the external appeals process. They're going to have to show that information. So working closely with your healthcare team is extremely beneficial. I will say, though, a lot of healthcare professionals do not know about the external appeals process. So that is something that maybe you're going to have to tell them about, and they might be surprised by it. Sure. But they're the ones who are going to be extremely beneficial with it. I will also say we have on our Triage Health website, I believe it can also be accessed through Triage Cancer's website, but if you go to triagehealth.org, we have a health insurance appeals navigator that will help create the specific letters that you would submit with these appeals process. And it is completely free to use. So if someone is having a hard time drafting like an appeal letter, this is an extremely beneficial tool to use. And I will also make a note on the cost of the external appeals process. So depending on the state you are in, you are either going to go through a state agency for the appeals process, or you are going to go through a federally facilitated appeals process. We do have information on our chart of state laws on, depending on what state, which one you go to. The federally facilitated one is of zero cost to submit the external appeal. States can choose to have a cost for their external appeals process, but they cannot charge more than $25.
Interesting. That's really helpful. Is an external appeal denial the end of the road?
Depending on your type of health insurance. So if you, in general, yes, that is the end. If you have an employer-sponsored health insurance that is self-funded, there is the opportunity to go through like a court claim for it. I will say it can be an extremely drawn out process, and you are limited in the type of recovery you can get through that process. So it is limited to the actual cost of the medical service that was denied. You can't like recuperate any attorney fees or any like court costs associated with it. So you are limited in the amount of recovery.
That's very helpful.
Mhm.
Sorry to cut you off there.
Oh, no, it's okay.
I did have a comment in here that says, I can vouch for working with your medical team. My insurance would not cover the Natera test, which is an MRD test for cancer, but she is tested regularly at her cancer center and avoids a bill of $4,500 every 3 months. If they do the test at home, it's $4,500 versus in facility where it's $0. So something to just keep in mind. That's interesting. That's quite a difference for a test that somebody could be paying out of pocket for. I am going to throw a poll in the chat real quick for those that are still here. If you wouldn't mind to take this, I would appreciate it. It helps us modify these webinars for future use and gives us good feedback from everybody that is here. So there's 2 questions to this. Please feel free to take it while you're still here. And don't hesitate to ask any questions while you're here as well. We do have Laura for a few more minutes, so I just want to encourage that. I do have another question, Laura. You had mentioned FSA and HSA programs through your insurance. Can you speak a little bit more to those and what the advantages of using maybe one versus the other would be? I know that's kind of a complicated topic. Every time we have open enrollment for our organization, that's always a question that's asked, brought up again and continually. I think there's a lot of confusion around what those are and what advantages they offer.
Yeah. So these are types of pre-tax savings accounts. So an HSA is a health savings account and an FSA is a flexible spending account. And you can put money into these savings account pre-tax. And as long as you use that money to pay for certain qualifying medical expenses, you don't pay tax on that money. There are a few differences with them. So an HSA is only available to those who have a high deductible health plan. So the number or the specific number for how much the deductible has to be changes every year. I believe in 2025, it's around $1,600 for an individual plan and around like $3,300 for a family account. For like the actual deductible amount. And so if you have one of these types of plans, you can get a health savings account. You can open it yourself through a bank. Maybe it's offered as a benefit through your employer. It just depends on where or what your employment is or whether or not you have this high deductible health plan. A flexible spending account, these are only available to those who have employer-sponsored health insurance, and it is a benefit that's offered through your employer. So you cannot open a flexible spending account yourself. It has to be open with your employer. So the benefit is that pre-tax savings on it. It's an account that maybe is not available to everyone out there, and not everyone has the ability to put money into it to make it beneficial, but it is a potential opportunity to save some money if you do have this available to you. And we actually have a quick guide to high deductible health plans and HSAs and FSAs if you'd like to learn more information on those.
Helpful. Thank you very much. You had talked a lot about how the max out of pocket is a really important number to look at when you're selecting a plan. Will all plans have a maximum out of pocket, or are there some that you are just going to continue to spend until the end of the year and your plan resets?
So in general, with like employer sponsored plans, individual plans that you get off of the marketplace, if you have like a Medicare Advantage plan, those are going to have out of pocket maximums. With original Medicare though, which is like you'd have your Part A hospital insurance, Part B medical insurance, those do not come with out of pocket maximums. They Part B is like an 80-20 plan. So you would be paying 20% of your medical expenses for the rest of the year as long as you reach your deductible. So that can feel very alarming, like not
Sure.
having that out of pocket maximum and potentially having to pay 20%. Like if you're receiving IV chemotherapy that costs $10,000 a month, that's a lot of money to continue to pay, which is why there are Medigap plans. So they're Medicare supplementary plans that will help with the out-of-pocket expenses under Part A and Part B. And there's a lot of nuances with that Medigap plan. I don't know in detail you want me to get, but that is a way to basically get an out-of-pocket maximum or help reduce those costs under Part A and Part B, if that's where you go.
Yeah, very helpful. You had also mentioned making sure you understand if your providers are in network or not for your insurance plan. Do those numbers that kind of outline the amount you'll spend, your deductible, do those go out the window if you're, let's say out of state and wind up with an out of network provider?
It could be. So usually if you go to an out of network provider, that is not any expenses you occur with that out of network provider will not be counted towards your deductible and your out of pocket maximum.
Sure.
Some health insurance plans do provide out of network coverage. Those usually fall in the category of like PPO health insurance plans. They sometimes have out of network coverage. They usually have a different cost share though. So let's say your in-network cost share is like 80-20. The out-of-network cost share will likely be around like 50-50. So you would have a higher cost share responsibility on your end. And then they also usually have a separate out-of-network, out-of-pocket maximum.
Very helpful. Thank you. I can keep asking questions. If anybody has any, please feel free to put them in the Q&A, but I have a lot of questions with this. It's a confusing topic, and we often get a lot of questions from our community. We try to direct people to you because you're the experts, but since I've got you here, you had mentioned, the primary driver of financial toxicity, at least from your perspective, is health insurance and your status with health insurance. We are seeing, increasing numbers of young adults that are diagnosed with colorectal cancer. And, if you're on your parents' insurance, get kicked off at 26, I believe. These people may still be in school. And if you're dealing with a cancer diagnosis at that point and you find yourself without insurance, are there any resources that people should know about to kind of help them manage that? Or are they looking at a marketplace plan or something similar?
Yeah. And I will note too, because that is a scary time. I remember when I was turning 26 and I don't know if I want to turn 26 and get kicked off of my dad's health insurance. I will say the COBRA that I briefly talked about, that is a qualifying event to elect COBRA. So you can actually elect COBRA and stay on your parents' health insurance. I think up to 36 months. That's the amount of time you can stay on it. But again, that can be really expensive because now you are responsible for 100% of the health insurance premiums. But maybe if you qualify for state Medicaid and they have a health insurance premium payment program, that could help reduce a significant amount of the costs. Also, if Medicaid in general is something you might qualify, if you meet your state's income and asset test, if they have an asset test, or I should say resource test. And then also getting or losing your access to your parents' health insurance because you're aging out does qualify you for a special enrollment period into the marketplace. So those are usually like 60-day windows to enroll in a health insurance plan on the marketplace. And when you do that, you'll put in information about like the household size and the household income, and you may qualify for financial assistance. The financial assistance is not completely going away. It's just the expanded financial assistance is where we're worried about losing, but there is still some available financial assistance to make the plans more affordable too.
And that's kind of a big part of this current government shutdown, is that expanded assistance and that going away. Any concerns from Triage Cancer's perspective about loss of insurance for groups of people, or just burdensome insurance costs or healthcare costs moving forward if we end up losing that expanded coverage?
It's been a very big topic for us,
I'm sure.
especially with open enrollment starting November 1st. Some states have already put out the plans for 2026, so some have started to see the costs rise, but November 1st, I think, is when we're going to start hearing a lot more feedback about the added costs, because it's not only that the health insurance premiums, or it's not only that we're losing access to the expanded financial assistance. I believe the expected rise in premium cost is also pretty significant. So I think it's going to be interesting, or not interesting.
I understand.
It's not going to be good when all of a sudden we see that rise in it, as well as the loss of the expanded financial assistance. And while the marketplace financial assistance is obviously a very big topic right now, I think we're also going to see a lot of people lose access to Medicaid as well, and a certain population that might also lose access to Medicare too. So I think it's a big topic at Triage Cancer, and I'm sure amongst everyone as well.
Yeah, it's definitely been discussed on our end, and it's unfortunate that it's becoming a pain point and something that people need to worry about. So it is helpful to know that there are resources and organizations like Triage Cancer that can help people navigate these challenges as they move through. So I do want to thank you for that. I had one more really quick question, and this is just about marketplace insurance. You mentioned a couple times in qualifying events. Does it have the same open enrollment kind of criteria that you might experience like with a healthcare or a employment-sponsored healthcare plan? Do you have to wait for a certain time if you haven't experienced a qualifying event to sign up for a marketplace plan?
Yeah, so with the marketplace, there is a fall open enrollment period that's going to start November 1st. And anyone across the United States can enroll in health insurance for a plan to start January 1st of 2026. As long as you enroll in that health insurance by December 15th, the open enrollment period does last a little bit longer than December 15th. But if you enroll in a plan after December 15th, that plan will not start until February 1st of 2026. So if you're looking for coverage to start January 1st of 2026, enroll in a health insurance plan by December 15th. But even though there's that open enrollment period, they completely understand that life does not revolve around open enrollment, and people may lose access or need health insurance outside of that open enrollment period, which is why they have certain special enrollment periods for qualifying life events, like losing employer-sponsored health insurance, or maybe moving to a different zip code, or maybe there was an addition to the family, like a birth, or maybe a death in the family, and you need health insurance coverage for that person. Those qualifying life events usually give you access to a 60-day time frame to enroll in that health insurance on the marketplace outside of that open enrollment period. There are opportunities to enroll prior to the actual loss of that employer or that health insurance coverage. So you can make sure that there's like no gap in that health insurance. But there's also opportunities to enroll after as well of that actual qualifying life event. But there might end up being a gap in coverage too.
Excellent. Thank you so much. We are wrapping up on time here, so I'm going to start moving through our closing slides, but I do want to thank you for the presentation. It's extremely informative. You obviously know what you're talking about, and I think when we're talking about topics like this, we need somebody to help kind of guide us. It's a lot for somebody to navigate. So
it is.
I do want to do a quick plug for how to get involved with Fight CRC if you're interested. We host events like this all the time. Please feel free to join us. You can also join our Resource Champions program, which helps distribute materials to people out in clinics who might need information. You can join us for any of our in-person events like Call in Congress, which is coming up in March for Colorectal Cancer Awareness Month. Apply to be a RAT if you're interested in the research side of things. You can apply to be an ambassador for our organization and help represent Fight CRC across the country. You can request resources directly from me to distribute for awareness, health fairs, and other events, or you can reach out to us directly from fightcrc.org for any volunteer opportunities. I do want to give a really big thank you to Triage Cancer and Laura in particular. I don't know if everyone can tell, but they know their stuff, like I mentioned, and I think really care. They're an awesome resource for anybody experiencing financial issues, needing navigation help, or really just if you have questions and need a good source of trustworthy information. Triage Cancer is an awesome resource, so please visit them. If you ask us for help, we're going to get you to Triage Cancer as well, because we know we can trust them when we know their information is good. And we know they're staffed by people like Laura who really care and are here for the right reasons. So again, Laura, thank you for taking the time out of your schedule to join us for this today. We really do appreciate it. We appreciate your partnership. Thank you so much.
And thank you for having me.
Absolutely. I do like to close these with our mission statement. You're getting some thank yous in the chat. So I think the people that are still here, I think they enjoyed it. So thank you so much. Fight colorectal cancer. We fight to cure colorectal cancer and serve as relentless champions of hope for all affected by this disease through informed patient support, impactful policy change, and breakthrough research endeavors. Thank you all so much for joining us today. And Laura, again, thank you so much for taking the time. We really appreciate it.
Of course, thank you.
Have a great day.